Hello everyone. Am I audible and visible? Let me know. Am I audible? Let me know. Okay, let us start. Now. So, welcome you all to the platform of Unacademy Future Doctors. Here in this channel, we are posting video for MBBS university exam going students. Okay, so if you have anyone in your friends or family member or your junior who is appearing for MBBS university exams, you can share these videos with them. I myself, Dr. Dipti Karya, I'm MD PhD Physiology. I'm Associate Professor and educating MBBS, nursing, and physiotherapy students. I have more than 17 years of teaching experience. Let me explain about our subscription. In Plus subscription, you can choose the best from the best. Here you can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access QuestionBank, which is having more than 25,000 questions. You can compete in live tests and quizzes. And within 12 months, we are coming with a printed note. Next is our iconic subscription. Here, your access to the best from two of the best. And these two are, one is Unacademy and Prep Ladder. With Unacademy, all the features I have discussed. And second, that is Unacademy and Prep Ladder with Prep Ladder. Here the features are, you can have clinical and integrated essential, you can have video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and more, rapid revision and snapshots, treasures in 2021 notes. You can subscribe from your mobile, either Plus or Iconic subscription. You can use my code DIPTI10 and you can get 10% discount on each and every subscription. Now, longer the duration of subscription, cheaper are the rates. So, if you are first or second MBBS students, you can go for longer subscription. Now, today we'll discuss about one-liner, short questions. In university exam, you will be having long questions, you will be having short notes, and you will be having one-liners. They are either for 1 mark or 2 marks. So, some here I have taken those questions, those who are with reasoning. Simple questions I have not taken, that what is normal RBC count, what is normal WBC count. These questions I have not taken because you can get those questions from long questions. Okay? So these questions are with reasoning. Sometimes you may not find answers of these questions in any of the book. Okay? So please go through this question answers. These are very important and they are very helpful to you for your university exams. Now, starting with first. First question is, blood buffers prevent changes in pH of the blood. Now, in blood, what happens when pH of the blood changes? Okay, so here what happens whenever any acid is added, okay, acid is added to the blood. So the pH of the blood becomes acidic. And we have three buffer systems. One, that is body fluid buffer, which is there in blood. Second, respiratory buffer, and third, that is renal buffer. So this body fluid buffer mechanisms, they immediately act. Okay? And from which important one here acting, that is bicarbonate ions. So this H plus ions which are added in the blood, they are neutralized by bicarbonate ions and they form carbonic acid. Okay, which is further converted into H2O and CO2 and it can be easily excreted. So the strong acids are converted into carbonic acid, that is weak acid, and thus they prevent major changes in the pH of blood. Okay, so this is the answer of the question. Second question, gamma globulins are called immunoglobulins. So what are gamma globulins? As we all know that plasma has got plasma proteins. The plasma proteins are albumin, globulin, and fibrinogen. Okay. From this globulin, alpha, beta, gamma globulin. Okay. So this gamma globulin, that is, you can see here, this gamma globulins, they are immunoglobulins. Okay. These are immunoglobulins. Okay. Now, gamma globulins, all the gamma globulins are not immunoglobulins, but immunoglobulins are a part of gamma globulins. These immunoglobulins, they form antibodies. Okay? And these antibodies, some of the immunoglobulins are not gamma globulin, but all the gamma globulins are immunoglobulins. These antibodies, they are important for humoral immunity. Okay? So this is the answer of this question. Okay? Then third is platelets. They get stick to wet or rough surface. Okay? Now here you can see when endothelium is smooth. Now these platelets are moving blood, so they will not attached with the smooth endothelium. Okay? So this one here, platelets, they will not attach to the endothelium. So platelets are not attached with the smooth endothelium. But when this endothelium becomes rough, or you can say whenever there is injury to the endothelium, there is release of von Willebrand factor. This von Willebrand factor, that is a large protein which is produced by cells of the blood vessel. And these proteins, collagen and thrombin, they act at the site of injury and they increase platelet adhesion. So which are the factors they increase platelet adhesion? One is von Willebrand factor. Second one, that is collagen and thrombin. They increase platelet adhesion. Okay? Then if donor's plasma, fourth question, contain agglutinin against recipient RBC, agglutination does not occur. Normally, when agglutination occurs, donor's RBC reaction takes place between, important thing here is donor's RBC and recipient's plasma. Okay? Plasma. Okay? But if suppose donor plasma is there, which is having antibody, is there any chance of having reaction with recipient's RBC? No, because donor's plasma, that is in very small amount. Suppose if you have transfused 500 ml of blood, then it has got only 300 ml plasma and small amount of antibodies are there. That gets diluted in 5-liter blood. So there is no reaction here. Okay, so this is the answer of the question. Then fifth one, thymus is important for development of immunity. How thymus works? What is the role of thymus here? Thymus, all of you know that it is important for processing of T lymphocytes. So one role, that is processing of T lymphocytes. T lymphocytes. Okay. Second thing, make the T processing. What happens in processing? T lymphocytes, they are made in such a way that they cannot produce other T lymphocytes against our own body tissue. So self antigen is recognized. So that is the function of thymus. Second, it releases hormone thymosin. Thymosin is released, and thymosin causes differentiation of stem cells. Stem cells are differentiated, and it causes production of lymphocytes and migration of lymphocytes. production, and migration. Okay. So these are the role of thymus, which is important for immunity. This is the answer of fifth question. Sixth one, why there is increased incidence of tumor with advancing age? What is the reason for increased incidence of tumor? As we have discussed in our class, that what happens when any normal cell is transformed to cancer cell. Transformation to cancer cell. What happens? Our immune system recognition of the cell by immune system. Okay? And this immune system destroys the cell because it is non-self entity. It is not self. It is different. So it is destroyed. So destruction. Okay? This is one. But as the age advances, with increase in the age, our cell mediated immunity, because this is the function of cell mediated immunity. So here cell mediated immunity decreases and therefore chances of tumor increases. So this is the answer of question number 6. Question number 7. Blood doesn't clot when it is in the circulation. What are the reasons why blood doesn't clot? So there are 5 factors which are responsible for prevention of blood clotting. They are: number 1, you can also write down smoothness of endothelium. Smoothness of endothelium. Okay, that is one factor. Second factor, that is presence of negatively charged particles in the endothelium. Particles in endothelium of endothelium. So negatively charged particles are there. Therefore, plasma proteins, which are also negatively charged, they are repulsion of plasma proteins. That is second cause. Third cause here, that is blood flows, so it will not clot. Blood flow, third cause. Okay. Fourth cause, that is heparin and protein C, they are present. These are natural anticoagulants. They prevent blood coagulation. And fifth cause, that is fibrinolytic mechanism, also gets activated when fibrin is formed, fibrinolytic system. So these are the causes for prevention of blood clot when it is in the circulation. Then now, next is blood clot retracts after coagulation. After 30 to 60 minutes of blood clot, after 30 to 60 minutes, it gets retraction. Okay. What is the cause for retraction? Because of thrombothenin. Thrombothenin present in the platelet, also actin and myosin. They are responsible for blood clot. Okay, retraction. Next is RBCs without nucleus. RBCs, they don't have nucleus, but they can work. They can function for 120 days. Why is it so? Because RBCs, they are dependent on the glucose metabolism. And this glucose metabolism is carried out in the cytoplasm. This is by HMP shunt. So although RBCs, they don't have mitochondria, nucleus, no other organelle, still they remain for life for 120 days. Okay. Next question. In HIV, immunity of the individual falls. Why is it so? Because in HIV, this human immunodeficiency virus, it attack on CD4 plus cells. They are T cells and monocytes, and they are important for cell mediated immunity. So what happens? There is fall in the cell mediated immunity. Okay. Next is HIV increases susceptibility to infection. Why HIV increases susceptibility to infection? As we have already discussed, same thing. CD4 cells are affected, and CD4 plus cells, they are important for cell mediated immunity as well as humoral immunity. Okay. Okay. Next is leukocyte classification. As you all know, they are granulocytes and agranulocytes. Granulocytes are neutrophils, eosinophils, basophil, and agranulocytes, they are lymphocytes and monocytes. Okay. Next is MN system. What is the role of MN system? Important here. MN system is normally not used, but it is important for paternity test. In case of paternity dispute, paternity test means, suppose if you want to find out whether this person is father of this child, you can do this test. How? Suppose baby's blood group is M, okay, and suspected father's blood group is N, then this person is not father of this baby. So this way we can exclude, it is not confirmed, but we can exclude that whether this person is father of this child or not. For confirmation, one can do DNA fingerprinting, DNA test. Then, name two autoimmune diseases. All of you are knowing this. We have discussed rheumatoid arthritis, then Hashimoto thyroiditis, then other is Graves disease. These all are autoimmune disease. Next is isograft. Isograft can easily be accepted. All these questions I have kept, they are from previous year university papers only. So go through these questions. These questions are, answers are not given anywhere in any of the book. Okay? So isograft can be easily accepted. Now what is isograft? Isograft means when tissues are transplanted from one person to another person who is identical twins. Identical means having same MHC complex. MHC complex is same. Identical twins, monozygotic twins. If we are transplanting tissue from one twin to other, then this is isograft. And these isografts are not rejected because they have same HLA and MHC. So this immune system will not produce antibodies against this kind of graft. Okay, so this is isograft, which is not rejected. Then next question is, vitamin K deficiency leads to bleeding disorder. Why? Because when there is vitamin K deficiency, vitamin K is required for the synthesis of factor number 2, 7, 9 and 10. These factors are required for blood clotting. Okay? So when these factors are absent, then blood clotting is affected. Okay? So here same thing, vitamin K deficiency causes prolongation of clotting time and serious hemorrhage. Okay? Then next is, lymph nodes are called defense barrier because these are our first line of defense and protect us from bacteria and viruses, because lymph nodes, they are the sites where our lymphocytes are present. So if they are not there, then affect our immunity. Okay. Next is, clotting time is prolonged in liver disease. Why? Because in liver disease, what happens, whether it is acute or chronic liver disease, there is one causes decreased synthesis of clotting factors. Sometimes decreased removal of activated factor. Activated factor. So activated factors may remain for a long period of time. Okay? Sometimes platelet defect also is there. And fibrinolysis is also increased. So because of all this, in liver disease, clotting time is prolonged. Okay? Next is, folic acid deficiency produces megaloblastic anemia. Here, this question. Folic acid and vitamin B12, these two are important for DNA synthesis. DNA synthesis is required for maturation of RBC. Maturation of RBC. So in case of deficiency of folic acid, RBCs are immature and immature RBCs are large. Okay? And therefore that is megaloblastic anemia. Next is ABO incompatibility. Rarely causes hemolytic disease like Rh incompatibility. Why? Because in ABO, immunoglobulins are IgM type and these are larger and they cannot cross placenta. Okay, this is the cause. Mismatched blood transfusion may give acute renal failure. Why there is renal failure in mismatched blood transfusion? We have already discussed. Okay? Here what happens? Whenever there is mismatched blood transfusion, first of all, there is hemolysis. Okay? Hemoglobin is released. Okay? Then hemoglobin urea. Once hemoglobinemia, then hemoglobin urea in urine. And it blocks the kidney tube. That is one cause. Okay? Second cause, sometimes toxic substances, they cause renal vasoconstriction. And so no blood flow, kidneys, they stop their function. Okay? Then third cause, because of acidic urine and decreased GFR, there is renal tubular damage. So renal tubules are not working, and that results, all of these three results in acute renal failure and results in coma and death. So these are the causes. Next is, this is same here, question may be asked in such a way also. Mismatched blood transfusion may cause death. So here you have to write down renal failure, and renal failure leads to confusion, conversion, coma and death. Next is hemoglobin urea by blood transfusion. Here you can see hemolysis is there, hemoglobin is released. Once there is hemoglobinemia, then hemoglobin in urine. Okay? Then hemolytic anemia is associated with jaundice. Why? Because of hemolysis, hemoglobin is released. This hemoglobin we have discussed is converted into heme and globin. From heme, iron and 4 pyrrole rings are formed. And these 4 pyrrole rings, they form bilirubin. Sorry. And this bilirubin level, when increases, there is jaundice. Okay? Next is hypoproteinemia leads to edema. What is the cause of edema in hypoproteinemia? So you can see here. Hypoproteinemia, what happens? Plasma protein level decrease. Okay? So colloid osmotic pressure decreases. As colloid osmotic pressure decreases, fluid comes out from capillaries. It comes out from capillaries into interstitial fluid, and that is edema. Okay? So this is the cause. Next is ESR has got prognostic value. Prognosis means it is important to know progress of the disease, not the diagnosis. So what is the degree of progress, that is severity of the disease, is measured by ESR. Suppose ESR is raised, means how much severe inflammation is there, that we can find out. So prognosis is find out. Next is MCV is decreased in iron deficiency anemia. In iron deficiency anemia, what happens? RBCs are small, and when RBCs are small, mean MCV means mean corpuscular volume decreases. Another is MCH also decreases in iron deficiency anemia. Okay? Along with that, MCH is also reduced. Okay, now define MCH. This is next question. MCH means mean corpuscular hemoglobin, that is average amount of hemoglobin in one RBC. Okay? So this is MCH and normal value is 28 to 32 picogram. Now, next is endothelial surface factor we have discussed. That is, they prevent adhesion of and blood coagulation. Next is orally given vitamin B12 is not effective in pernicious anemia. Why? Because in pernicious anemia, there is deficiency of intrinsic factor released from parietal cells. So whenever we give vitamin B12, it will not be absorbed. So we have to give them intramuscular. Clotting time is increased in liver disease, we have discussed. Next is fresh plasma is transfused in purpura. What happens in purpura? Platelet count decreases. And when we are transfusing blood which is not fresh, what happens? Platelets, they become non-functional after 36 to 48 hours. So here we require to give fresh plasma. Folic acid deficiency we have already discussed. This is also, we have discussed that stored blood is not suitable for transfusion of WBC and platelet. Why? Because WBCs, they become absent and inactive after 24 hours and platelets after 36 to 48 hours. Then defect in coagulation occur in obstructive jaundice. What happens in obstructive jaundice? Either because of liver disease or because of obstruction, this liver cannot perform proper function, and because of that, clotting factors are affected. Therefore, abnormal clotting takes place. Then blood indices have diagnostic value in types of anemia. Blood indices, I think all of you are knowing, MCV and MCHC. So when MCV is normal, MCHC is normal, that anemia is known as normocytic normochrome anemia. Okay, if MCV is reduced and MCHC is also reduced, that is known as microcytic hypochromic anemia. Then when MCV is increased and MCHC is reduced because it is anemia, that is known as macrocytic hypochromic anemia. Next is clotting time is longer than bleeding time. Why? Because in clotting time, there is cascade of reaction takes place. That is, one enzyme activates second activates third one. So that requires time. So it takes time. Then what is the clinical significance of ESR? We have discussed. That is, ESR is having prognostic value. Reticulocyte count, normal reticulocyte count in adult, that is 0.5 to 2.5%. And in infants, it is 2 to 6%. And reticulocyte count, if it is higher in adult, that denotes anemia. Or what happens when anemia is there? Our bone marrow starts producing large amount of RBCs and they are immature, released in the circulation, reticulocytes. Okay? Now, what is hemophilia? That is sex-linked genetic disorder, and here males are sufferer, females are carrier. And in hemophilia A, there is deficiency of factor 8, and hemophilia B, deficiency of factor 9. Hemostasis, we have already discussed, spontaneous arrest of bleeding by physiological processes. Causes of neutrophilia, physiological and pathological. Physiological causes are exercise, pregnancy, and parturition. Pathological cause is important. You can remember that is acute infection, like microbial infection. Other are chronic infection, metabolic disease, tissue damage, and all. Next is, what are the advantages of biconcave shape of RBC? We have discussed. Because of biconcave shape, there is rapid diffusion of oxygen. Second, large surface area for diffusion. Third, when fluid enters, minimum tension is applied on the membrane. And fourth, they can easily squeeze through capillary. So these are the advantages. Then how RBCs get energy? They get energy from glycolysis HMP shunt. What is purpura? That is hemorrhagic spots occur because of defective or decrease in the platelets or defective functions of the platelets. That is purpura. What is hemolysis? That is destruction of RBCs and release of hemoglobin. Agranulocytes, we have discussed lymphocytes and monocytes. Here the question is, what is agranulocytosis? That means it is a serious condition in which there is extremely low number of granulocytes. These number of granulocytes, mainly neutrophils. Okay. Causes of eosinophilia, they are allergic condition, asthma, like allergic condition, and blood parasitism, parasitic infestation or infection. What are the extrinsic and intrinsic factors of Kessel? Extrinsic factor is vitamin B12, and intrinsic factor that is secreted by parietal cells. What is immunity? Immunity, that is ability of our body to resist against pathological organism like bacteria, virus, or any other toxic substances. So this is all about important one-liner questions. Thank you.